Welcome everyone to today's UK Healthcare Behavioral Health Community of Practice. We are so delighted to have you with us. I'm Trudy Matthews. I work as Senior Director of Quality and Value Strategy here at UK Healthcare and have had the privilege of working with our teams from our behavioral health team from UK Healthcare and also with New Vista on the content for today's Behavioral Health Community of Practice. We have a great group of presenters and experts for today's conversation. One of the things we want to emphasize is for those of you who are joining us is that we really love to have a lot of interaction. So we want you to keep your mouse and your phone handy because there will be some opportunities to scan a QR code and to join into a conversation. And so we really want to be able to engage you in this and get your thoughts on all of what we're doing. If you're less familiar with Zoom, I know a lot of us already know that the bottom of your screen generally is the chat button. Definitely keep that handy. And then on our next slot, we'd like to know where folks are coming from. So there's a handy little feature at the top of your screen where it says View Options. There's a little bird's beak or V next to View Options. You can drop that down and there are some commands there. One of them is Annotate. And we'd love to have you click that Annotate button and maybe put a heart or a stamp where you're joining us today. You can see already folks are starting to fill in where they're joining us from. Excellent. I love how how quickly people can learn how to use Annotate. There we go. We've got quite a few folks coming from Central Kentucky, but really all over from Jefferson County, Davies County, McCracken. Awesome. Boyle. Fantastic. Great. We're so delighted to have you with us. One of the things we're going to talk about today too, in our next slide is our next activity. A lot of what we're going to be talking about today is around non-pharmacological interventions and kind of some things that you can integrate into your practice besides medications to help with depression, anxiety, and other mental health conditions. And so if you're on today, we would love for you to grab your phone, and Katie's going to give us instructions about how to use the Mentimeter app, and we're going to do our first activity using that.
Sure. Thank you so much, Trudy. For everybody that's joining today, what we'll be doing is a Mentimeter activity. The question up here is, which apps or techniques for improving mental health, de-stressing, or promoting mindfulness have you found useful? If you could go ahead and use your phone to scan this QR code right here on the screen, that will take you to the activity, or you can click the link in the chat that Alicia just dropped in there for us. If you're uncomfortable with either scanning the QR code or clicking the link in the chat, please feel free to respond to this question in the chat, and one of our team members will add your responses to the activity. So just bear with me a second and I'll switch screens so we can see everybody's responses that are rolling in.
I'm going to give folks just a little bit of time here to begin entering. Oh, we've got some really good thoughts coming up on the screen. So it looks like the Calm app, meditation, going to the gym, Instagram motivationals, breathing exercises, exercising, getting outside. Getting away to the beach, that's great. That always makes me feel wonderful. The Rethink app is one of the apps that folks have mentioned here. TikTok, there's a ASMR. Again, meditation, calming app, the gym, reading, breathing, gardening. Map My Hike, there's another app. The Headspace app. This is great. A lot of good. Oh, someone says spending time with my ducks. I want to go to your house. That's fantastic. Great. Well, you all can continue to add in your thoughts to this Menti code. This is great. just another way for us to kind of learn from one another different techniques for helping to promote improved mental health. All right, back to our program here. Excellent. That was really wonderful. Great. Love the feedback from you all, and thanks for participating in that. We're going to go into our first presentation today, and I'm delighted to have with us Hobie Dotson, who works as a clinical psychologist and assistant professor with UK Healthcare in our Department of Family and Community Medicine. And Hobie works with patients, has worked with them from all over in Hazard, Georgetown, Lexington. His academic and professional interests include wellness, positive psychology, integral psychology, and mindfulness. And he uses motivational interviewing, mindfulness, cognitive behavioral therapy, and solution-focused approaches for helping adults with a wide variety of mental health concerns. So he really is in a great position to talk with us about some of the things that can be integrated into primary care practice to help with your patients. You know, particularly I think about there are oftentimes folks who don't want to take medication, or maybe the medication is taking a while to take effect, and maybe they're looking for additional things to add to that to make. And so Hobie's going to talk about those tools today. So take it away, Hobie. Thank you for being with us.
Thank you, Trudy. All right, yeah, so that's right. So if you want to go ahead and go to the next slide, I'll go ahead and tell you what we're going to talk about. We're going to go over some simple interventions, just very brief and simple, that patients can relate to and understand and maybe make some use of in their lives. We're going to talk about diaphragmatic breathing, the importance of that, what it looks like. We'll do the three-part breath, which will be a good way to actually practice that kind of breathing for people. Patients often benefit from that. We've got focusing on the five senses, getting out of your head, particularly when you're anxious or tense, and kind of tuning into the moment, the here and now, the 5, 4, 3, 2, 1 technique. We'll go over progressive muscle relaxation, gradual relaxation of muscle groups. We'll go over the TIP technique, which is from DBT, dialectical behavior therapy. And then talk about social connection. There's been a lot of research out about that. We'll touch on that. Look at simple, pleasant activities list, which is one of those things that is more powerful than you think. I think most of these are. Most of these, when you look at them, you're like, well, this is obvious and seems really rudimentary. But these are the sorts of things that people don't always think about. And once they do, it makes a difference in their lives. We have the 3 good things, very powerful. Technique for happiness, for increasing happiness. And then we'll go over the 4, 7, 8 breath at the end, another relaxation technique. So if you want to go to the next, thank you. All right, so let's start talking a little bit about diaphragmatic breathing. So breathing changes with mood, and mood changes with breathing. So if you get anxious and excited, what happens to your respiration rate?
Increases.
Yeah, it tends to increase, right? So then what might happen if you reduce your respiration rate? You slow it down. What might happen to your mood?
More calm.
Yep, that's right. You'll calm down and relax. So it's basic, it's obvious mind-body connection that we're aware of, but people don't always think about that when they come to looking at their anxiety and how to address it. So we want to really pay attention to that. Now, 2 types of breathing to focus on here is looking first at chest breathing. So this is just the shallow, typically more rapid breathing that we do a lot in our lives. When we sort of run around in tension, and we kind of just, we have this real quick shoulder breathing that we do that tends to make us feel a little bit more tense and nervous. So it can be cyclical, and that can actually be part of why people can get into panic attacks. They can be tense, and then they start breathing more shallowly, and then that gives their body and brain a sense that something's wrong. Fight or flight mode. I'm under attack. I better be ready for some kind of urgent response. And then they might breathe even more quickly and even in more of a shallow manner. And then the cycle continues. The problem with that is that most of the time we're fine. And it's something that in our head that we're reacting to as opposed to an actual emergency. So, so yeah, you can get head, back, neck pain from breathing this way. It can lead to anxiety and panic and unneeded stress. So diaphragmatic breathing, this is often taught with people who use wind instruments, people who sing, those sorts of things, learn diaphragmatic breathing, usually slower. It's more deep. You can even hear the sound when you breathe, it's different. When you breathe like chest breathing or shoulder breathing, it's got a higher pitched sound. When you're breathing from your belly, it's got, the sound is if you hit a large garbage can, it's got that resonant sound. It sounds more like that. It's important for rest and digestion. Relaxation sends the message that, hey, everything is okay. We're not under attack. We wouldn't be able to breathe this way otherwise. This is what the body is made for. And obviously, it can quickly reduce feelings of anxiety and stress. Next slide, please. Thanks. Okay, so 3-part breath. This will be good. I'd like you all to actually do this for a moment. Those of you who can, to just take a second to do it. This is a full-bodied natural breath that you see a baby take. So instead of those little shallow breaths that we often take when we're nervous, notice that babies and sometimes animals, you'll see their belly expand and then it expands out to their whole body. It's like their whole body is breathing. That's kind of what we're going to practice here. But I'm going to break it down into 3 parts. So we'll do sort of a 1-part breath, a 2-part breath, and then a 3-part. So if you can, just put one hand, let your back be straight, your feet on the floor, put one hand on your chest and one hand on your belly. And see if you can keep your chest kind of still and just breathe into your belly and let your belly expand. And just take a couple of breaths like that and practice it with a long, slow exhale. This is the diaphragmatic breathing. So go ahead and start. Long, slow exhale, keeping your chest kind of still. Another breath, long, slow exhale, and then one more. And you might notice that's kind of difficult to do. You can let your breath return to normal now and notice how that's a little awkward for some who haven't done this before, but that's something you can practice and actually get better at. It can be good for anybody, really. Just being more aware of the breathing patterns and practicing a different way of breathing that's more relaxing. And with your patients, you may notice some people, sometimes they're talking to you, they're quick, and then they catch their breath really quickly. A lot of those people are kind of caught in tension patterns and more shallow breathing habits. Okay, let's do the second part. Now what we're going to do is breathe into your belly first, let the air expand up into the chest. When you exhale, let your chest come in slowly and then your belly. So let's try that second part. Go ahead, breathe in. Belly first, up into your chest. Slowly exhale, chest comes in, and then your belly, and relax your muscles. Do it again, belly in, belly out. First breath, out, expand into your chest. Your chest comes in when you exhale slowly, and then your belly. So we're going to add the third part. This is going to be the shoulders. So basically, you can think of it like a balloon. Your belly expands, then your chest, and your shoulders rise up just a little bit. Then when you exhale, the shoulders come down, then the chest, and then the belly. So let's try this. Breathe into your belly first. Expand it up to your chest. Shoulders come up a little bit. Exhale slowly. Your chest comes down, your shoulders come down, then your chest comes in, and then your belly. Try it again. Belly, chest, shoulders, and then exhale, your shoulders come down, then your chest, and then your belly. And then you can let your breath return to normal. And then notice how that feels. A lot of times what I'll do is I'll have people rate their anxiety 0 to 10, both before and after. And most all the time, they're able to relax their anxiety a couple of points just by doing that. We broke it up into a few parts there, and I did some explaining, but that can be a simple approach to know about. That's good. Good to see somebody feels good about it. That's good to hear. Like the feedback. So, okay, next. So this is another simple approach. This is a very simple idea, but you can get a lot of mileage out of it, because especially in dealing with people who are lost in their heads. And many of us are a lot of the time, more than we'd like to admit. We can dissociate, be disconnected with everything else. We're running stories in our head for too much of our lives. So this is a simple approach, especially when you have high levels of distress and you can't seem to get your bearings. You can just think 5, 4, 3, 2, 1, and go through your senses one at a time. So, and we can do that now if you want, just to kind of practice it and pay attention to it in a mindful way. See if you can acknowledge 5 things around you that you can see. Just notice textures or shapes, colors, any subtleties that you notice about 5 different things. Just kind of look around and just really notice maybe something that you haven't noticed before, or an aspect of this thing that you haven't noticed before. Now let's acknowledge 4 things that you can touch. Whatever it may be, doesn't matter. Just notice, like I said, textures there, the way things feel, the way that they affect you when you do touch them. Just kind of being in the here and now again, bring yourself to the moment. See if you can hear 3 things. You hear my voice, that's 1. You might hear a heater or something like that, or other noises in the air. And taking actually a moment to appreciate qualities about those things you don't always notice. 2 things you can smell. See if you can find things. Even if you needed to move around to do that, that would be fine. You might notice the detergent on your clothes, or if you've used lotion, you might smell that, or if you have coffee or something, take a whiff. Just appreciate it for a moment. And then 1 thing you can taste, maybe just notice the taste in your mouth. And or if you have something to taste, that would be fine. You can take a sip of that coffee or something like that. Okay. Now, let's see here. What would be next? Okay, so let's go on to progressive muscle relaxation here. So this one's a really good approach. That there's a few different approaches to use on it, but the usual way that you approach progressive muscle relaxation would be releasing tension in one muscle group at a time. You often would tense that group of muscles for about 5 seconds, hold it when you inhale, and then you would slowly breathe out and relax that group, and then you would go on to the next. You would give yourself about 10 seconds to just relax those muscles. You always want to, again, you want to, use mindfulness and notice the subtleties of how your body feels when you relax. These are examples of some of the things, the parts of the body that you might focus on. They're broken down in many different ways. You can do it how you like. Most of the time, people will start at the feet and move up the body, sometimes around the back around the shoulders, chest, go to the belly and arms, and then the face all the way up to the top of the head. And then after that, you can relax the whole body. Now, there's different ways. I like to kind of break this down into a few groups here in terms of levels of intensity. One is you could simply do a body scan. You can simply scan the whole body and notice how it feels. Just a mindful awareness approach to just say, all right, well, what do my feet feel like right now? What about my legs? And kind of just give yourself some time to notice how you feel all throughout your body. You could also just simply focus on relaxing that part of your body. Like right now, if you want, you could rest your arms and hands and just see if, without doing anything, if you can simply relax your hands a little bit or your arms. Just the tiniest little bit of relaxation. Such a simple thing. This is one of the simplest things that people don't do. And when they do it, they really notice a difference. It's kind of funny. So you could simply relax your whole body one at a time, or you could do the tense and relax part to create that relaxation response. I'm guessing a lot of people have done that. People will do that with yoga. It's really common. You'll tighten those muscles for about 5 seconds. You hold your, breathe in while you're breathing in or holding your breath, and then you exhale. You drop it and you let your muscles relax, and then you focus on relaxing those muscles with that relaxation response. Yoga Nidra is an option when people have, it's self-hypnosis is what it's called. And it's basically all it is having an idea or something that you want to focus on, getting yourself into a very relaxed state. And then once you get into that really deep, relaxed state, focusing on those goals and envisioning what you want to achieve. So it's pretty simple. Now, YouTube is a wonderful tool for all of these things. Your patients can find something on YouTube to guide them through it, and they can find the time, the voice, the attitude that works for them. So yeah, that can go a long way for people. So next we have the tip for distress tolerance. This is, as I said before, this is from an approach that's used for this DBT, dialectical behavior therapy, that's used for dealing with a lot of stress, distress, anxiety, emotional management, and those sorts of things. And a pretty interesting tip, I think, is to look at temperature. Sometimes just thinking about changing the temperature a little bit, and maybe taking a hot bath or taking a cold washcloth, putting it on your head. But a particularly interesting one is creating this type of response that happens when we go underwater. That's another thing that we can do to send our body messages that, hey, this is a good time to slow down the heart rate, to relax, because we don't want to use too much energy. So if you can, cover your eyes with maybe a Ziploc bag full of water, or if you have your face in water, you can hold your breath for 30 seconds and quickly create that response when you have a strong, high level of distress. Another thing could be intense exercise. When you have emotional energy built up in your body and you just want to let it out, you want to be aware of, you wouldn't want to do that in a violent, aggressive way. People used to think that was a good thing, but then you're just kind of coaching people to be aggressive. But intense exercise can certainly be good and help people to relax. Paced breathing, we've been going over that, and we'll continue to a little bit. That's a big one. And then paired muscle relaxation. You also could say progressive muscle relaxation is like we were speaking about. So a lot of the times when you're breathing with those long, slow exhales, you focus on relaxing your muscles. You may even say the word relax as you do it. Next slide, please. Okay, so social connection. There's been a lot of research on social connection lately, and I think it's only going to grow. For those of you who are not familiar with it, it's seems to be affecting about every health condition you can think of, people's social lives, mortality, weight loss, cardiovascular disease, diabetes, cancer, depression, et cetera, and the list goes on. It just seems, and it makes intuitive sense, that the more high quality social connections that we have, generally speaking, the better off we are. And if we're missing those important connections, our health tends to decline. So there's a lot of stuff out there that's going to continue to come out regarding this, and how it can affect your well-being. So one idea here, this one hasn't been, as far as I know, hasn't been researched a lot, but one approach is to look at just as you would apply the same technique that you might with thinking about medication or exercise, the FIT approach. And this would be looking at, all right, what's the frequency? How often are people connecting with others? Are they doing it on a regular basis? Just getting curious about that. What's the intensity or quality? They're really connecting closely with people. What kind of relationships? How often are they doing it? And what type? just kind of being aware of those kinds of things in terms of understanding how connected your patients are with others. Another thing you can encourage people to do is to make a list of their social connections. So you may think about it in like 3 levels. Who are the people that are closest to me, and the concentric circles. So the inner circle, and the next would be people who are somewhat close that maybe you would want to connect with a little more. And then some people you don't know that well that maybe you would like to get closer to as well. And then making effort to connect with those people, friends or family, whomever, encouraging patients to be intentional about that, to actually see those people written down, and then to make efforts to change that. And I did notice somebody made a comment about some benefits they've seen researched in going underwater. So you all want to check those out. That would be good. I also see something there about social connections. Good stuff. Thanks for your feedback. And go ahead. Let's go on to the next here. Another simple thing. This is another one of those things you wouldn't think of because it just seems obvious. Like, hey, why don't you do some pleasant activities? We forget to do those things. We get wrapped up in busyness of life, and we don't even realize the balance. And also there are times where we don't know what to do. We're like, I don't know. I feel like I want to improve my mood or do something different, and I can't think of what that is. Having it all written out, making a list of things that you enjoy, finding, tailoring that list. Look online, you'll find hundreds. There's lots of good examples of things that people can do. It helps with your positive thinking about things that you enjoy, and then start to plan those things. Put them in your day-to-day schedule, make habits of it, and find the balance that works best for you. This is a handy thing to do. So moving on to the next, please. Thank you. So this is the 3 good things research. This is really one of the most powerful ways we've found to increase happiness. Very simple technique, but it's been well researched. You want to be able to, first of all, you want to make time, set an intention to do something, to actually have some time at the end of the day, basically before you go to sleep, to write down 3 things that went well today and why. You want to get pen and paper, write it down. Doesn't have to be big. It can be small, doesn't really matter. You want to just think about how it made you feel and why it happened. A couple of sentences is fine. If you want to write more, you can. It's good to do that right before you go to sleep. And it can be very powerful. Pay attention to what you notice after 2 weeks. So research has shown that just a couple of weeks, this can impact your happiness and well-being for 6 months to a year. A lot of gratitude research out there. 3 things that went well and why they went well. Next, please. And then finally, we have the 4-7-8 breath. This one's very effective. A lot of people really benefit from it. I guess what I'll do, and you can look at the particulars there, like putting the tongue on the back of the top of your teeth. And some of the, you exhale, you make a whoosh sound. But what we'll do briefly here before I wrap this up is, let's just take a couple of breaths, breathing in for a count of 4, holding it for a count of 7, and then breathing out for a count of 8. So if you're ready, you can go ahead and exhale first. Now breathe in. Now hold it. Slowly breathe out and relax. Now again, breathe in for 4. Hold it. Slowly breathe out and relax. And we'll go again, breathe in. Hold it. Slowly breathe out and relax. And just let your breath return to normal. And then notice how that makes you feel. Very simple approach and technique. Many patients benefit from it, and they can practice a couple times a day at least, sometimes more. And they start with 4 times in a row, and sometimes might move up to 8. So that's it. That concludes my presentation, and thank you.
Thank you so much, Hobie. That was wonderful. I feel more relaxed, and I hope everybody who's listening to the call today does as well. That was great. Really appreciate you sharing those resources with our listeners. We're going to move now to our next presentation and group of presenters. We've got Erika Burnside and Lori Croley, who are with us from New Vista, and they're going to talk about basically how you can leverage the resources of your community mental health center. Certainly, New Vista is a great resource for us here in the Bluegrass region, and there are other community mental health centers across Kentucky that are also do the same work that New Vista does. And so they're going to talk with us about how to leverage that and really have success in creating improved access. I want to say first, just to introduce Erika is a primary care provider, and she enjoys working with her clients and does individualized experiences that allow her clients to be heard and seen without time constraints. And she's a APRN, as you can see. And then Lori works as a certified community behavioral in New Vista Certified Behavioral Health Clinic as a clinic manager, and then licensed marriage and family therapist. So we are so delighted to have you both with us. And you all of our speakers will also be part of our panel in just a minute. Go ahead, Erika and Lori. Thanks so much.
So Trudy, thank you for having us. We're grateful to be able to come and be a part of the discussion. So we would like to share some of the evidence-based guidelines and best practices that we are using to aid in improved access of care for clients, along with strategies that we are implementing within our organization to improve success of our clients. And listed here are some of the strategies that we are using, not limited to, but we chose the ones that stood out to us that we would like to share. The first one being adopting a team-based care approach to improve outcomes. And what that looks like for us is the development of our integrated care teams. So within our integrated care teams, we have multiple disciplines who understand what their role is and what the expectation is of one another on those care teams. So this occurs on every level within our certified community behavioral health system. We make intentional and proactive choices to collaborate and assist clients in accessing care and engaging in services that promote positive outcomes for them. Whether that be through first conversation that they have with our intake hotline, to the office assistants that we have, to treatment providers, support services, psych providers, primary care. At various times throughout the episode of treatment for clients, they have opportunities to access a variety of services to enhance outcomes. We also work to convey a no wrong door approach, that in any program that a client enters, that we have a universal gateway so that they can access any additional service within New Vista. We also conduct warm handoffs that I'll let Erika speak into because she does this beautifully.
Thank you again for allowing us to participate and be invited to this. With the warm handoff, I think in my experience, having been a home health nurse and working in the community, it's important for our clients to feel accepted, loved, integrated in all aspects. And so when a client is here receiving any type of service, be that therapy, here for a support group, if it has been made known that they are in need of primary care or psychiatric care, we make a point to reach out and introduce them, let them see who that person is, get a feel for who that person is. And that intimate personal touch has made a significant difference in our retention of our clients and them coming back, being adherent in their medication, and also allowing them to see that we're working collaboratively and as a group. So that has helped us tremendously in engaging and allowing us to be seen in our community, but also for those clients to leave here who are our best form of advertisement to say, things are done differently here. And this is a one-stop shop, but not only is it that, they're invested and they care about us. The next point is the real-time structured yet flexible decision-making process. We engage in real-time structured yet flexible decision-making. We have regular communication within our integrated care teams through curbside consults to weekly structured meetings, through peer supervision and staffing with our psych and with me, the primary care provider. We make a point with every satellite office that is serviced here at the Bull Hub to sit down with our clinicians via Teams and to make certain that we're discussing the needs of our clients. And if anything comes up, that we're making a point to reach out to them, to engage. If they're missing appointments, we're doing that call to see kind of what's going on. We firmly believe that our clients are humans and they deserve to have something different in this concept of CCBHC.
So as mentioned before, we do operate under a no wrong door policy through person-served engagement strategies. For example, we have regular contact with our clients. The population that we serve do struggle at times in accessing treatment due to a variety of different barriers. And so we are in regular communication with them, trying to understand, decipher, break down any barriers, any obstacles that may stand in their way in accessing the care that they need for improvement, such as transportation, financial strains. We've also increased our service areas, our service hours outside of the traditional hours that we do serve from 8 to 5, understanding that clients may need additional hours outside of those. So just being flexible in our approach with clients. If clients fail to keep appointments, again, we just have open, candid conversations about what we can do to help them access the services that they need. We make regular telephone calls to them. We send out letters just to try to bring them in as much as possible to help meet their needs.
Something really exciting that we have recently added is Title Care, and that is a real-time telehealth engagement experience. That is a scheduled provider, nurse, and client session that allows us to utilize Bluetooth equipment to make certain that for our clients who have difficulties getting to Bull County for an in-person visit can have their needs met, personal and primary care wise. We make a point to break down that barrier of transportation with the use of Title Care implementation that allows for me to be able to listen to heart, lung sounds, visualize oral cavities and their throat, their ears, their skin, and also assess the affect of the client. That's quite different from your normal telehealth visits that have taken place throughout the pandemic. And a lot of our clients have felt unseen, unheard, and a very unpersonal approach with just doing the telehealth when it comes to primary care. So this concept has opened the doors and is going to allow us to extend our outreach and touch more folk.
So lastly, we make it a point to celebrate accomplishments across the board and address breakdowns that are occurring. We create intentional space within our peer supervisions, support service meetings, other staffings with our psych providers, our primary care, to review the success that we're experiencing on a clinical level, along with some areas of growth that we can work on. We work to recognize, to review, and learn from breakdowns throughout some of the following strategies. One, we have regular hub management meetings on a weekly basis to look at what's working on a cellular level so that we can establish and maintain efficiency for our staff, organization, and specifically for our clients. We also have regular integration and operation meetings with senior management to discuss what's working, what isn't working, what are some efficient changes that we can make to better serve our clients. We make sure that on every level, whether that's clinical, non-clinical, administrative, management level, that we are discussing constant, open communication, talking about new services that are being provided, what the referral process looks like. Do we need to change up any workflow so that we have a more seamless flow for client success? So those are some of the evidence-based best practices that seem to be working well for our agency. Go to the next. So the next two slides are flyers that we have readily available along with many others, but these are just the two that we wanted to share. And so these, again, are readily available to clients when they come in, when we go out into the community, which happens very frequently. Working with community partners, these are things that we can share with them. And if you look, they're very precise, explains what a certified community behavioral health center looks like, the services that we provide, a little bit about New Vista, and how clients can access services.
This slide right here kind of specifically goes over the primary care services. We want to make certain that we encompass all that we're doing here, and we have made certain to place these in the offices of our therapists, out in our lobby areas with our community partners. A lot of folk have seen New Vista as a provider of mental health only. So this has been a way for us to get this idea out to the community and also to our outlying satellite offices to make certain that everybody knows that primary care is here. We are collaborative with mental health, and we're here to serve and nurture and provide. So it's a pretty nice flyer. I'm pretty proud of that flyer.
Well, the community, the CCBHC model is really a great innovation for Kentucky. And I know that New Vista, Pathways, North Key and Northern Kentucky, and a couple other spots in Kentucky have these types of integrated services available. So it's great to hear more about that and learn about that. We're going to transition now. Thank you both. We're going to transition over to our panel discussion, and we're going to include Hobie and Erika and Lori in that, but also include Dr. David Hudson, who's the CMO for New Vista also. And I just want to introduce Dr. Hudson briefly. He's a graduate of the University of Kentucky College of Medicine in our general psychiatry program. And UK Child and Adolescent Psychiatry Fellowship. He spent 13 years with New Vista and practices child and adolescent psychiatry, and then also serves as the chief medical officer. So he's a great addition. We had Dr. Hudson on our last program, so brought him back by popular demand, and really appreciate you being with us as well, Dr. Hudson. So we want to start out our panel conversation with another one of our Mentimeter activities. So Katie, you want to provide some input for folks on how to participate?
Absolutely. Thanks, Trudy. We had a lot of really good participation with our last activity. So we are going to follow the same kind of process. If you have your phone available, go ahead and scan that QR code right there on the screen so that you can participate in telling us about what kind of barriers you've experienced or do you anticipate experiencing when incorporating some of these mental health techniques and strategies into your practice. Again, if you're not able to scan that QR code, Alicia will drop the link in the chat so that you can follow along that way. And we'll be sure, hang on a second, I may need to advance this slide, I'm sorry. And we'll be sure to go over those responses. Is everybody having an okay time accessing the barrier slide?
It looks like it's going to the techniques for de-stressing and promoting mindfulness, Katie.
Okay, if you scan one more time, I believe I've advanced the slide to a point that
there we go.
We should be able to. I'm sorry about that.
So while we're waiting, for folks to kind of tee things up, I'd like to go to our panelists as we're kind of getting some feedback from our participants, and just kind of get some feedback on the strategies that Hobie talked about in his presentation, and just, get some feedback from your experience working with clients. How would you use some of those techniques, and what kind of patients would you use some of them with, for depression, anxiety, other things? Do you use it with any patients, or only those who screen positive for a certain condition? Any thoughts on that from the panel as we're getting folks putting up their responses?
Trudy, I'd just like to thank Dr. Dotson for giving those great descriptions. And he did something that was incredibly important during his talk, and that's demonstrate the breathing technique. Do it in real time, because you can, give a list of, do some progressive muscle relaxation, do some deep breathing exercises, do some guided imagery. Those will all help. And that's true. They will all be helpful if you do them, but the chance of just telling someone to do it and then actually following through is very low. So demonstrating those things in real time is invaluable. Those techniques that you have in your back pocket help everyone. So if someone does have complaints of anxiety or mood issues, you certainly are welcome, and it's a good time to bring those things out. But I tell folks frequently, the brain is an organ in the body. Things that are good for your body are good for your brain. So talking specifically about exercise, sleep, nutrition, in the context of, whole person health and care. But again, what I find, if, the message of get more sleep, eat well, exercise, just walk, one ear out the other. So I like to pick one topic. Like if I'm talking about nutrition, I'll say, okay, tell me what you have for breakfast, what you usually have for lunch, what kind of snacks do you have? And then have one specific goal. Okay, what thing can we change between now and then, whether that's decreasing, soft drinks, or can we set a goal of getting 5 servings of fruits and vegetables a day? And let's think through, which ones do you like? Which ones okay, we're going to take that one off the list. Which ones, well, that's French fries are technically not going to, make a score on our vegetable and fruit list today. Let's see what else we can find. So those real-time examples, demonstrating in the moment, I think are invaluable. And
that's great. That's great. Well, there quite a few folks have really filled out some great things for us to talk about. One thing that I want to ask for everyone is just that, obviously during our visits are so short with patients. Can you talk through some strategies that you use? Do these interventions have to take quite a bit of time, or how do you integrate them into a primary care visit or into and do it in a way that's efficient during the clinic process? Or any recommendations that you have for that? If we could scroll back up, Katie, that would be great. That was one of the questions, just not enough time during a visit to cover things to address.
So who was the question geared toward?
Any of our panelists at all who want to respond.
I'll tap in if you don't mind. So for primary care, the joy of working here with Vista, and one of the things that brought me here was the fact that we're not productivity based. So it allows us to spend that necessary time with the client. That is something that we hear a lot when the clients come back and they're talking to their therapist, that they don't feel rushed. So we incorporate that necessary time to do that initial visit. A 90-minute appointment is what I typically give for initial visit, anywhere from 30 to 45 minutes for a follow-up, for the necessary time allowed to be able to discuss their care, incorporate their care team, and to set goals to be hopefully accomplished by the next visit. So that's what, from primary care standpoint, I do.
Yeah, what I would state in folks that don't have that luxury, we're it's pretty unique in a CCBHC setting, but if in the standard primary care settings, if you identify something that they have a question or concern about, and then use that as your teaching point, whether it's sleep or whether it's nutrition or exercise, they're complaining of low energy, so if you can tie it to the chief complaint, that helps with that selling aspect. I saw a note about how do we get them invested. Take their chief complaint and say, I noticed we're talking about energy, or we're talking about a lot of anxiety lately. This is one way to address that concern you brought up. And then I would give them a resource that, since you've got 8 minutes to go over it sometimes, this is very important. This is why it's important. I'll throw out, Duke University did a study on the benefits of exercise versus antidepressant, and at the year mark, exercise won. So I throw out a little nugget of information, and then I try to give them a resource so that they can learn more and practice it. And then I say, so come back next time. I'm writing a note to myself, when you come back, we're going to talk about this again, so you can tell me, how that app worked or how that resource worked, and have those ready to go. So we use something called the My Strength app, which has a variety of health-related skills and tasks, and that is actually open to the entire community. It's a paid subscription service, but we use See the Good code, and that will basically pay the subscription for anyone in the state. So addressing it, linking it to chief complaint, giving what you can in your time limited spot, and then giving a resource that they can use as follow-up is one way to address those time constraints.
I love that Dr. Hudson, that's really very valuable. I want to also kind of follow up on something that you mentioned there around the client engagement and the willingness to participate versus a quick fix. And there's just a couple of spots here where some patients just want meds. So how do you also talk through this with clients, the benefits of non-pharmacological interventions versus pharmacological interventions? And that's for Dr. Hudson or really anybody, any of our panelists.
I'm happy to jump in, and then, don't want to monopolize, but what I usually do is go back to classic research studies like the treatment of adolescent depression studies, or the studies that have used both comparative therapy to medicine to combination treatments, because there's very good data to show the benefits of therapy, especially in regards to the long-term benefits of therapy. Same holds true with studies done on social connectedness or exercise. Those things that are done over the long term actually have longer success rates. So the Duke SMILE study, the standard medical intervention versus the long-term exercise study, is a good example of that, is to say, okay, at the 4-month mark, it was tied. Exercise and Zoloft in regards to treatment for depression had very similar responses. But at the 10-month mark, exercise was far superior. You had roughly 35% relapse rate of depression if you're on medicine only, and you had less than a 10% relapse rate if you're incorporating exercise. So just showing the data really shows these things like exercise or connectedness or getting good sleep give you the optimal benefits. So talk about medicines as being a good tool, a good helper, but we want that symptom relief, but we also want the best chance of maintaining that symptom relief. And by incorporating these non-pharmacologic interventions, you're really setting yourself up for success.
I'll second that. I also have noticed, I've often point out the benefits of the combination of both, medication and therapy and these sorts of approaches. But even if you're going to use medication, another thing I'll add on is that if you've got that crutch to kind of help you along the way, you're also going to be making changes in your day-to-day life. So at least I could advocate for the importance of both and them wanting to find some way to improve their lives. Another thing, if I may add on, well, first of all, I also want to agree, think that's a wonderful thing to tailor it to the complaint or to the chief complaint. I think that's another really good point Dr. Hudson made. And also tailoring your feedback or your suggestions to what you observe in the patient. So just kind of noticing the way that they are, what triggers, what steps out to you as stands out to you as seeming to be the best fit for them based on your observations. And I should note on there that we're talking about when to do it. If somebody's really distressed, let's say beyond an 8 out of 10 on the scale, if they were going to rate their anxiety, it wouldn't be the best time to teach them one of these complex multi-stepped breathing approaches. They're a little too distressed at that time. That might be more of a time to where the cool washcloth could come in handy, or simply noticing the 5 senses. And you don't have to go through any complex details in that, but just kind of helping them, hey, take a deep breath if you can, observe your surroundings, notice some things that you can touch, be here in the moment, those kinds of things. So hopefully that can help a little bit with tailoring some of those interventions.
Excellent. Thank you so much. I noticed that we've got just a couple more minutes. And so I want to just address one more question in a little bit of a lightning round here, if we can. Just a question, can we scroll down just a little bit? Should these techniques that we've suggested, should we recommend these strategies to all patients or those that just screen positive on for depression? What are your thoughts on, again, how do you all calibrate that? Just real quickly.
Can be helpful for anyone. Most of the relaxation approaches are directly addressed to some anxiety, and some of the ones about improving your life can address depression. Fantastic.
Well, I thank you so much. I will say one of the comments on the screen is having a toolbox, a ready toolbox of things to share with folks in a short appointment time. That's what we've tried to do today. Hopefully, is have a nice package of ideas and techniques for folks to take. And I appreciate so much everyone sharing their expertise. This has really been an excellent webinar and a lot of opportunity to incorporate these into practice. And I feel personally more relaxed just as of today's discussion. I feel like I have some tools for my own life and managing stress. We want to go ahead and do a couple of housekeeping items as we close. Thank you all so much. First of all, let's say thank you to all of our speakers and panelists for excellent content today and discussion. Really appreciate that. We also want to emphasize for everyone who's involved with our community of practice that there is free training available. You can scan that QR code to access the mental health first aid training. We had our first class last week, and the comments from the training were excellent. People felt it was very valuable. Those slots are filling up quickly, and so want to make sure that everyone knows to access that training. We also have a survey. We love to hear from our participants what was helpful to you and helps us to tailor content for the upcoming webinars we're doing. And also that's a reminder that we do have some additional opportunities for learning coming up. Our Kentucky Children's Hospital pediatric team puts together a really wonderful set of pediatric town halls for our pediatric providers across the state. There's another one that's happening tomorrow at noon on dysfunctional disorder to destructive eating in children. And then also we have our next community of practice where we're going to talk about responding to crises, mental health crises in primary care, particularly how you handle patients in your clinic and have immediate access. And there's more information about our upcoming webinars as well as a host of resources on our Kentucky REC Behavioral Health Community of Practice site, as well as past webinars as well, which have had excellent information. Again, thank you all today for being with us. We appreciate so much our speakers and our team for putting together this excellent content. Please do sign up for Mental Health First Aid and give us feedback via the survey. We appreciate you all so much. Have a wonderful day.